First, it's reckoned that about 1 in 10 people who get COVID may be left with symptoms which go on and on. Now a team in Bristol from the Children of the 90s study is starting a project to uncover the mysteries behind long COVID. If they're successful, it could help people who are living with the effects of the illness for months. Here's our health correspondent, Matthew Hill.
Jamie Bridgman was one of the first to take part in the Children of the 90s study. He was one of more than 14,000 participants to have had their health and well-being monitored throughout their lives. He's still suffering from long COVID after being struck down with the virus in April.
Some days, like I said, you just don't want to, it's not you don't want to do stuff, you physically can't. You can't get out of bed, you can't go up the stairs.
Patients like Jamie will wear a wristband to measure exercise ability, breathing and heart rate. Of course, the children of the 90s are now adults, many of them homeowners, but there's a wealth of historical data going back 30 years to be drawn upon, including data throughout this pandemic. They'll also be asked to complete online questionnaires on mental health and brain function.
So we bring together electronic health records and then we look to define long COVID, understand what it is, and then deep dive in the cohorts like Children of the 90s to be able to follow up those people. That's how it will evolve through time.
They don't really know an awful lot about it, do they?
Absolutely. One of the major problems here is that we just really don't know how to define or how to track long COVID. We need to know those characteristics because COVID itself is just so frequent.
The £9.5 million research project involves other patient studies in the UK. That means participants will be invited to visit a London clinic for scans to look at potential damage to vital organs such as the brain, lungs and heart.
There's some limited evidence that we might see some scarring of the heart and also some damage to the brain. We might be seeing some small infarcts in the brain. But these previous studies have been relatively small and haven't included controls necessarily. So we aim to advance our knowledge further by including controls and having a more detailed investigation on larger numbers.
As the health toll mounts, scientists across the world will be awaiting the results of this ambitious project, hopefully before the end of the year. Matthew Hill, BBC Points West.